everyone. Welcome to Good Morning Silicon Valley. This is Michelle Cheng. Today we are very fortunate to have our special guest, Dr. Andy Lee. Dr. Lee is an expert in revolutionizing medical practice with Chinese medicine and advanced technologies. He was successful in treating the COVID-19 patients at Tonxu People Hospital in Henan, Kaifeng. He was the most recognized apprentice of Chinese medicine master Ni Ha-Xia. Let's welcome him. Hi, Dr. Lee.
Hi, Michelle.
I'm glad you could make it today. How are you doing?
Pretty good, thank you. Busy.
We appreciate your time to be with us, and we understand
Thank
it's
you.
a very severe situation. So, in your clinical experience, how do you think it's effective for Chinese medicine on treating the COVID-19 patients?
Yeah, it's a long story. We have been training quite a few, count by hundreds, Western medicine doctor, MDs in China for more than 1.5 years. We didn't prepare for these pandemics, but we did train the Western medicine medical doctors to study Chinese medicine. They have been treating different kind of pneumonia in the past. So when this COVID-19 broke out, obviously we would love to see how we can leverage the strengths of Chinese medicine to treat patients faster and cheaper. So indeed, we decided to treat the infected patients with Chinese medicine only, and using Western medicine as a verification. For example, we use a CT scan, we use a blood test, we use other things available in Western medicine to check, to verify our results. And it turned out to be very successful. We treat quite a few patients with severe symptoms, and they all recover. 0 deaths, no side effect. And the hospital that I advise has more than 1,000 medical staff, and none of them got infected. They all, we all asked them to take. We asked all of them to take a Chinese medicine in advance as a prevention to see how it worked, and turned out to be much better than we expected.
Yeah, at first, some people believe that COVID-19 was just like a flu, but now the situation has changed a lot because of the scary symptoms. So from your perspective, what do you think the difference between COVID-19, flu, and SARS?
They are from different viruses in Western medicine term, but in Chinese medicine, we don't look at the virus. We look at how human body deteriorate. Right? It's like if somebody shoot you with a machine gun or the handgun, you won't really care about what kind of bullets, right? You don't care who made the bullets, but you will say, hey, I got shot in the chest, I got shot in the tummy. So for Chinese medicine, we have been treating this kind of pandemic in the past 2,000 years, probably more than 200 times in the history. And so we look at the symptom, how how patient deteriorate. And interestingly, we even in the Western medicine, we believe it's very different than the common flu or even SARS. But in Chinese medicine, we see the pathology is very similar. How the lung got infected, once the lung got infected, how it goes. In Chinese medicine term, there are two major paths in terms of lung disease. One is overheated. Lung will get overheated. It's more like a SARS. The other side of the spectrum is you get a lot of the liquid or dense liquid inside your lung, right? So in this episode of the pandemic, we see COVID-19 have both. Part of the patient have some kind of symptom like SARS, but probably two-thirds patient have symptom that more come from the impact of a lot of excess liquid inside your lung. So, but in Chinese medicine, we did see, in the ancient literature, and we did see both of them, and we did treat both of them in the past. But this time, even though the symptom has been familiar to us, but it's much more serious, and it progress much faster and much more complicated. So in the past, you might have one kind of symptom, and you don't have the other kind of symptom, right? But this time you have all mixed up, so it's hard to diagnose and hard to treat. But in general, if you can look at the symptoms from Chinese medicine point of view, it's treatable, and we did prove that.
As we know that you directly and indirectly participate in treating the COVID-19 patients at Henan Tonxu People Hospital. So how do you think the Chinese medicine and Western method can work together? Do you think Chinese medicine alone can dealing with COVID-19?
Yes, I'm biased, so I don't want to say it's totally correct or not. Just my perspective and my experience. I do believe Chinese medicine can take care of the severe symptom by itself. It's like we did in this hospital, and we did treat these COVID-19 patients, not the mild one, the very severe one. They need ventilators, and we did treat them pretty well with Chinese medicine only, and with Western medicine help from the testing side, right? The CT scan, as we discussed earlier, we use CT scan, we use all the blood tests, all different Western medicine technology to help us to make sure we are making progress. In the ancient time, we don't have those kind of tools, right? So the Chinese medicine doctor will do all different kind of checking. For example, the pulse, the tongue. They see how the patient cough, and we use that as more like a big data. We collect all different symptoms here, there, and to see if patient get worse or get better. But nowadays we have CT scan, we have all the blood tests. It's much easier. But in terms of treatment, we use Chinese medicine herbs only.
One question, some people think the virus might be gone during summer because of the high temperature, but some of them worry that it may get another peak after summer. What do you think about it?
It's really hard to judge at this moment, but yes, when the weather gets hotter, it does get better. It's like SARS. SARS started like a late summertime and came to the fall and winter. It got very bad, and it got much better in the next summer, right? So, but the problem is timing, right? We are seeing in the U.S. it's a bell curve. It go up like a bell curve, right? Go up and the peak and go down. If we are in the peak right now, if we are, it's like a stock market today, we have a rally, right? We went out stock market like crazy because we see, oh, we are peaking. Even if it's true, that means we still have about 380,000 people will get infected, right? Because at the top of the bell curve, you have half the infected people, and after you peak, you still have another half, and it has a long tail. If this tail go into fall season, then we might have trouble. If this tail end up like settle down significantly by, like say, June, July, then it's much easier to us to contain the virus. But if this tail drop not as quickly as we expected or as we wish for, it go into the winter time, for example, in September, October, and then we might have the second wave. That will be harder to treat. And also we know the virus mutate very faster, right? So they mutate very fast. And when it comes to second run, if you look at the historical case, the second wave is usually stronger. If we can contain the virus by summertime, that's a great news to everyone. If we cannot, then we might have problems.
So everybody is sheltering in place. Everybody's at home. So from your perspective, how can we protect ourselves from the virus? How can we stay healthy? Can you give us some advice?
Well, in Chinese medicine, we always say the lung has high correlation with worry, right? In Chinese medicine, each organ has certain correlation, if you will, to certain emotion. For example, the liver is highly correlated to anger. And even in Western medicine, we know if you get angry very often, liver function goes down. In the other way too, if your liver is not that good, patient normally get angry easier than others. And lung is highly correlated to worry. So if you are super worried about this virus, it's not good for your health. Even in Western medicine term, we know the immune system is impacted by your emotion, right? So the first thing to do is live normally. If you take it easy and you less worry, it's much better for your lung, for your general health. The second thing to do is try to do some exercise. A lot of people work from home, and a lot of my patients, they say they sit in the chair for hours, even longer than what they did at office. Why? Because people like they finish some work at home, then they switch to Facebook, they switch to YouTube, right? They keep watching things. They have nothing to do. They kind of worry. Like it's easier to look at YouTube, right? So exercise. The third thing is, if you don't mind Chinese medicine herb, I will recommend there are certain herbs in history we know they are useful not directly to defeat the virus, but it's more like enhance your body liquid circulation. If you using Western medicine term, it might say your metabolism is faster or your lymph system is more defensive. So it helps if you do like to take some herb. That certain herb is very mild and helps your general health and probably will make you a little bit easier to go through this pandemic.
Thank you so much, Dr. Li, and we really appreciate your time and input. And I hope everyone can stay healthy during shelter in place. So thank you very much. I'd like to see you next time.
Take care.